Hi, folks. Do you sometimes feel like your bad habit is getting in the way of your successful life? Do you feel embarrassed by your habit? Do you just wish you could stop that annoying habit? Yes. Well, do we have the solution for you? Our newly developed Habit Away system can rid you of that annoying habit for good. Sounds too good to be true? Well, give Dr. Egotastic just a few minutes of your time, and we'll explore how this revolutionary new system can rid you of that annoying habit.
Hey folks, I'm Dr. Egotastic. Have you ever had one of those annoying habits that you just wish you could get rid of? Well, look no further. We have got the best program for you. Now, back in 1973, Azra and Nunn came up with a habit reversal system, which we have put into place. What makes ours better? We're just that awesome. So why don't you sit back and relax, and we're going to go over the 4 steps to making you habit-free.
Hi, folks. Please meet Rhonda. Rhonda is in the waiting room reading a book and whoop, twirling her.
Hi, Dr. Egotastic. My name is Rhonda, and I have a big problem. I developed it during these years, and I keep twirling my hair anytime when I read, actually when I'm studying. It happens when I'm home, at the office, and it gets quite disturbing lately because what is going to happen if somebody is going to step in my office and is going to see me doing this? So the thing is that I'm aware of doing it, so that's why I'm here, because I want to ask you to please let me know what I can do in order to get rid of my habit.
Okay. Well, let me give you a little information first. There are 3 different types of nervous habits. Well, habits. The first one is a nervous habit. You seem to have a nervous habit. Now, that can be anything like twirling or stroking your hair, tapping your pencil, chewing on a pen, people that crack their knuckles, that type of thing. They don't really serve any social function, as you're not reinforced by anyone. But it's supposed to be, it's thought at least, that it reduces nervous tension. Usually involves your hands, of course, and it becomes a problem sometimes when it's very extreme in nature or it's bothering you socially. Now, the second kind is a motor or vocal tic. That's Now, a motor tic is a repetitive gesture, a jerking movements of a muscle group. Like, have you ever noticed guys do this a lot? They kind of crack their neck a lot and stuff like that. A lot of people do think that it's due to not nervous tension, but muscle tension. So sometimes it can be related to an injury, and after the injury gets better, you just kind of keep doing it. Who knows why? Now, a vocal tic, that's a whole different animal. It's a repetitive vocal sound that really doesn't serve a social function either. You just kind of do it. So it can be throat clearing, like all the time, or coughing. Sometimes it can be, you have a cold and you start doing it. You just never stop. Now, Tourette's syndrome. Tourette's syndrome is different from all other 3 of them. Tourette's syndrome is sometimes thought to be a neurological type of thing, but it's also more of an interaction between genetic and neurobiological factors, usually diagnosed when there are 2 or more tics in 1 year. And then finally, of course, we have stuttering, which, we all know what stuttering is. Speech disfluency, they call it. So let's get started helping you out with your nervous habit of twirling your hair.
Okay.
The habit reversal procedure is implemented in a therapy session with the client who exhibits the habit disorder, like Rhonda, who twirls her hair as a nervous habit. After learning the behavioral definition of the habit, the client learns to identify when the habit occurs or when it is about to occur. These procedures constitute the awareness training component of habit reversal. It is absolutely key to habit reversal training.
Okay. So, I know that you're aware of your hair twirling habit. It's very critical that you realize when you're about to do it and when you are doing it, so we can kind of work with that. So why don't you take me through that?
Okay, it usually happens when I'm reading. When I'm reading interesting books, boring books, I don't know, always when I'm reading. So at the time when I'm reading, I always go like this. I twirl my hair and I continue doing it for a few minutes.
Okay.
Actually, more than a few minutes.
Now, I want you to think real quick. When you're sitting there reading your book, do you normally notice when your hand goes up to start twirling your hair?
Of course I notice. I'm aware of it. I'm
Okay.
aware of doing it.
Good. That's wonderful. That's exactly what we need. Because this procedure is not going to work unless you're aware of those instances when that happens. And it looks like you are, so we are well on our way.
Yes.
The client, Rhonda, now must learn a competing response. That's a behavior that's incompatible with the habit behavior. And she must practice the competing response in session after each occurrence of the habit. Next, the client imagines the situations in which he or she will use the competing response outside the session to inhibit the habit. Finally, the client is instructed to use the competing response outside the session whenever the habit occurs or is about to occur.
All right, Rhonda, so it looks like we need to find you a competing response. Now, a competing response is something that is incompatible with your behavior. So when you're twirling your hair, what do you think? Do you think maybe you could, grab a pencil or...
That would be a good idea.
Okay.
Okay, thank you so much.
Now, what we're going to do is I'm going to give you a book to read.
Okay.
And then we'll see, if you're aware of what you're doing. And every time you feel that hand coming up, I want you to grab that pencil. About 1 to 3 minutes, okay?
Okay.
All right, let's see how this works.
Okay. Oh my God, practice this, Dr. Bowman. Oh, no.
Good, good. Now just hold that real tight. 1 minute goes by. Excellent. Okay. So let's talk about some of the instances, both, in your work life, at home, that type of thing. Do you think that this competing response is something that you can do on a regular basis?
Well, I would love to do it because I want to get rid of my habits. So this is a very good idea, and I'm going to follow your advice.
Okay, good. Now, before you leave, we're going to go over some imaginary situations. I'm going to have you close your eyes and imagine, that you're in a situation where you want to do that, and we'll just practice a little more before you go home. Okay?
Okay.
All right.
Significant others in Rhonda's life, such as her husband and her daughter, are instructed to prompt Rhonda to use the competing response when the habit occurs outside the session. They are also instructed to praise the client for not engaging in the habit and for using the competing response successfully. The involvement of the significant others is called social support.
All right, Rhonda. Well, it's been about a week since we've talked, and how are things going?
Well, I'm feeling much better about myself, and I have pencils all over my house, and my husband and my daughter are always there helping me out with them. Mom, take a pencil.
Good, good. Have they been really good about, praising you when they see you doing the pencil thing, and are they good about, supporting you socially?
Yes, of course, because I feel like my bad habit is going to go away. So I think you did a good job. So I'm very grateful for that.
No, it's absolutely my pleasure, and I'm very excited that you're making such wonderful progress.
Thank you so much.
Of course.
Finally, the therapist reviews with the client all the situations in which the habit occurs and how the habit may have caused inconvenience or embarrassment. This review is a motivation strategy, which increases the likelihood that the client will use the competing response outside the treatment session to control the habit. Good luck, Rhonda.
All right, Rhonda. Well, we've been meeting for a while now, and you're doing so well with your habit reversal training, and just want to commend you on that. I wanted to kind of go over some motivational strategies for you. I want you to real quick just tell me if there are any instances, at work, at home, socially, where you feel that people have kind of gotten on your case about your hair twirling, or it's been, a detriment.
Well, it did not happen at home because I have a very good family, and my husband and my daughter support me with everything I do. But there is a problem at work when I'm at the office, I'm at my desk, and the clients are entering, so they cannot find me doing this.
Okay.
So it's embarrassing.
Okay.
It's not professional. So that's the only one time when I get embarrassed, and I really don't like it.
Okay. Well, like I said, you're doing great on turning this habit around. So I want you to, if you can, try and use that mental image of you twirling your hair and someone coming in your office and the unprofessionalism that you just expressed. Use it as a motivator for you. Think about that and be like, ooh, I really want to touch my hair, but I'm not going to. And use that as a motivator for you. Okay?
That's a good idea. Fantastic. Thank you so much.
Absolutely.
Okay, doctor. I want to ask you something else.
Sure.
I have a good friend who is in school, and she's a perfect straight A student, and she doesn't have any other problems but stuttering. When the teacher uses the Socratic method, she just freezes and she begins stuttering and she cannot complete a sentence. So I was wondering if you could advise me.
Sure. Like I said earlier, there are different types of habits. So we have, yours, which is more of a nervous habit, but we also have motor tics, or, vocal tics, which would be like the stuttering. And let's say someone who snaps their neck, a good competing response for them is to kind of tense up all their muscles so they can't.
They cannot do it anymore.
Yeah. So unfortunately, though, with stuttering and Tourette's and those type of habits, that doesn't necessarily work because you can't really freeze everything in your voice box, and it's also very intrusive. So we do what's called regulated breathing, diaphragmatic breathing. And the competing response is relaxation, and you have uninterrupted diaphragmatic breathing. That's a big sentence, I know. What it is you're breathing with your diaphragm. So you're in and out with no breaks. So, like with your habit, you have to identify when that stuttering is going to happen, and then you just describe the different types of stuttering that they exhibit. And so it's kind of like a process, just like yours, just a little bit different. So once you're aware of the stuttering and when it's actually going to happen, or not you, but your friend, you use your breathing and you're pulling air in and out and letting it just kind of go over your vocal cords. So you're going to practice with a couple of words, or your friend is, kind of like that, and then you're going to try it outside the session. Now, when they notice that they're stuttering, they're going to stop, start that diaphragmatic breathing, and speak as they're doing this breathing technique. So it's almost impossible for them to start stuttering again.
Okay. Actually, that will work because she always stutters at a certain hour, so she knows when it's going to happen. So she can practice all of this.
Okay. Keep in mind that they do have, the success with that type of breathing exercise. You have to practice, and but in time, it works absolutely great.
That's fantastic. Thank you so much.
You're very welcome.
Hi folks, I really hope that you've enjoyed our presentation today on the Habit Away system of habit reversal. Now, just so you know, you can get this fantastic program here at our Center of Awesomeness for $18,000 a day. We do have scholarship programs, so why don't you give us a call and we'll see if we can't get you up here for an interview and you can kind of check the place out and see how you like it. Don't forget, even you can get rid of your nasty habit.
The habit reduction techniques presented in this segment may not be as effective when working with children or individuals who suffer from mental retardation. When working with individuals with mental retardation, alarm bells and differential reinforcement or rewards have been shown effective when using habit reversal procedures. With children, physical and verbal reminders of competing responses may be necessary. Rewards, alarm bells, social disapproval, response prevention, brief restraint, antecedent control, and punishment have all been used effectively with children. Thank you.